My name is Tom Darlington Baloja, the principal investigator of this project concerning about enhancing 19 lockdown, underscoring Kyotera district rural places. We worked with my colleague Dr. Dorothy Chagaba, but also teamed up with district officials of Kyotera district, as you can see. This project is coming out of the need that happened when when government locked down educational institutions, and came up with an idea of continued learning during the lockdown by coming up with radio lessons, televisions, and distribution of materials to children and students. We noticed that given the statistics by Uganda Bureau of Statistics, we noted that radio coverage is low and even television coverage stood at only 19%. But more so, even learning materials for some parents could not be interpreted. And for local communities, thematic curriculum could not be favored because in local communities we emphasize local languages, but the materials were in English. So we came up with this project to extend learning with the purpose of facilitating effective learning in rural contexts by, number one, record electronic lessons which can easily be relayed to learners using voices recorded. Then to store these lessons electronically, relay the lessons to learners using most appropriate and user-friendly technology or a device in a particular rural context, and to also monitor learning from homes by local teachers cognizant of the need to respect standard operating procedures of COVID-19. The methodology we used was basically action participatory design, basing on themes of electronic lessons and delivering them based on a device that is mostly used in that community, which are loudspeakers when communicating to the public. So we had teachers who recorded lessons, and there were 16. And we also had owners of these loudspeakers who mounted them and delivered these lessons. We also had experts who were teachers in those rural places, those rural villages, and the learners from those places, and we targeted 11 villages, targeting P1 up to Senior 3. So data on quality of lessons and learning was analyzed through use of a multiplicity of methods, especially simple descriptive analysis, but qualitatively oriented. As you can see, the lessons developed were 168 electronically developed for primary section, and 126 for Senior 1 up to Senior 3, basing on the learning materials which had been distributed by the Ministry of Education and Sports during the period June to September 2020. We also came up with that timetable, which had a 260 minutes teaching timetable using 4.3 or 4 hours and 30 minutes in the 24 days in which the project was implemented in a 3 months. We delivered lessons, and some of those children, you can see in one of the photographs, one child is supporting the colleague in learning as they are listening. And in another one, the expert teacher is trying to guide some of the children who were learning, and you can see the real context of a village. We deployed experts in each of the 11 villages, and we also reviewed, we were able to provide lessons on memory cards and memory sticks to some of the parents who wanted them. And in this, they were able even to rewind these lessons. So we came up with a 3 blocks model, which we call localized electronic learning model, which is based on preparatory stage, individual learning stage, and assessment stage. And those are the ways how it moves. There is mobilization of resources, record electronic lessons, edit these lessons, and draw a timetable and arrange the lessons under the preparatory stage. You, in this individual learning stage, you relay the lessons using any method that is most appropriate. It can be radios, screens, speakers, or even headphones, as long as a memory card or a flash disk can enter there. Then you can be able to rewind lessons at any time of your wish, where you have not been able to understand, unlike the radio or a television which runs through. And therefore, remedial and diagnostic learning can easily be implemented. This can be supported by use of quasi-teachers and retired teachers in villages to support this learning process. And therefore, we can even use it when schools open to support the large numbers which can come up. So the assessment can be done by the quasi-teachers with the support of expert teachers, and therefore assess progress of learning and report accordingly. What do we recommend? That government, parents, and leaders could possibly comprehensively support this kind of learning for children while at home, but even when the schools open. And the government can facilitate the project to develop lessons based on the entire curriculum of the academic year, and you be used in learning for all schools. So when schools open, these recorded lessons can be used by teachers to even improve on learning skills and buttress learning, especially where there are large classes, and for learners to revise. This can be enhanced with the support of quasi-teacher teaching and diagnostic learning. I thank you very much for listening to me.